Now I would like to invite Dr. Md Arshadul Azim sir to present his deliberation.
Respected chairpersons, learned audience, and my teachers, Assalamu alaikum. Before presentation, I should express my gratitude and thanks to GK Nephrology Group for giving me the opportunity. In our day-to-day practice, we are facing such type of reports. These reports are nightmares for the patient as well as physician also. This is a paper published in our journal, Bangladesh National Journal, this year. He stated that meropenem was found resistant up to 13%. And also our media highlights is that the antibiotic resistance aging closer to the health calamity and use of last resort drug rises as antibiotic become effective. I would like to permission from the chairpersons, I would like to use Bangla along with English. Our aske presentation e ashole kichu presentation e গরু রচনা বলতে গিয়ে কিছুটা নদী রচনা বলা হয়ে যাবে, কারণ গরু আমি তো আসলে খুলনা থেকে এসেছি, ওইখানে আসলে নদী পদ্মা নদী পার হয়ে আসতেছি। Yes, our today's topic is managing urinary infection with superbug. I am Dr. Arshadul Azim, working in Shahid Sheikh Abu Nasir Specialized Hospital, Khulna. Our talk outline today is antibiotic resistance is one of the major threats for global health and food security, and antibiotic resistance happens naturally, but misuse of antibiotics in human and animals are accelerating the process. Antibiotic resistance leads to longer hospital stay, higher medical cost, increased mortality, and exposed to with significant side effect. This is one poster circulated by World Health Organization about the antibiotic resistance awareness. What is superbug? Though this name is given by the media, the strain of bacteria, those are resistant to several classes of antibiotics or multi-drug resistant or pen resistant. Globally, 1.2 million deaths are estimated to be caused by antibiotic resistant bacteria in 2019, with a total 4.9 million deaths associated with antibiotic resistance. The impact of infection caused by superbug. The pace at which new antibiotics are developed has not kept up with that of the emergence of antimicrobial resistance. The threat of antimicrobial resistance can jeopardize other unrelated healthcare interventions such as organ transplantation, joint replacement, and chemotherapy. The different types of superbug: urgent threat like carbapenem resistant Acinetobacter, carbapenem resistant Enterobacteriaceae, Clostridia, and serious threat drug resistant Campylobacter, ESBL producing Enterobacteriaceae, multibacterial resistant Pseudomonas, and MRSA. And concerning threat is erythromycin resistant group A Streptococcus and clindamycin resistant group B Streptococcus. This slide shows the year of invention of antibiotic and year of shows reported antibiotic resistance. For example, linezolid introduced in 2000, and 2001 reported the linezolid resistance. And these are the antibiotic overuse, overprescribing, and continuous use in livestock. This slide shows the increased incidence of antimicrobial resistance, especially MRSA, vancomycin resistant Enterobacteriaceae, and fluoroquinolone resistant Pseudomonas with the duration of. But there is a scarcity of new drug or antibiotic. In 2008 and 2012, only 2 drugs have been approved by FDA. What we know: increased antibiotic use, increased resistance. Longer treatment, increased colonization, resistance more prevalent in healthcare facilities than the community. Antibiotic is not harmless. এখানে একটা গল্প আছে যে আমাদের গ্রামে বলে যে কাজ নাই, শহরে গেছিলাম চাচার জন্য একটা মামলা করে দিয়ে আসি। এখন আমাদের অবস্থা হচ্ছে যে কাজ নাই, একটা অ্যান্টিবায়োটিক লিখে দিলাম, truly antibiotic is not harmless. Unnecessary use of antibiotic leads to antimicrobial resistance and other serious type of infection also. One of the important issues is asymptomatic bacteria. It is harmless, does not need treatment with few exceptions, all of you know. And treating asymptomatic bacteria can lead to worse outcome because antibiotic also kill good bacteria and protect against more harmful bacteria. Overuse antibiotic also allow bacteria to develop defense against antibiotic, especially they become mutate and making treatment as ineffective. And pyuria is not a diagnostic in catheter associated infection, should not interpret as a infection. Factor promoting the drug resistance, exposure to suboptimal level of antimicrobial, exposure to microbes carrying resistant gene. And how does antibiotic resistance? All of you know. I am not going details. The carbapenem resistant Enterobacteriaceae. Enterobacteriaceae, large family of gram-negative bacteria including E. coli, Klebsiella and Enterobacter. Carbapenem resistant Enterobacterial infection which largely arise in hospital. Bacteria may be resistant to the effect of antibiotic by producing carbapenemase as defined in the WHO priority pathogen list. They usually affect people with compromised immune system or those residing in healthcare facilities. Treatment: currently antibiotic option for the treatment of carbapenem resistant Enterobacteriaceae are very limited. We can try with polymyxin, tigecycline, fosfomycin, aminoglycoside. Remove or replace the indwelling urinary catheter, ureteric stent and nephrostomy tube whenever possible. And ensuring good health hygiene, particularly when in contact with wounds and medical devices. Another culprit, extended spectrum beta-lactam is producing Enterobacteriaceae. The producing ESBL are resistant to penicillin and cephalosporin due to production of enzyme that break down these antibiotics. They are often multi-drug resistant and carries large plasmid containing many antimicrobial resistant gene. Treatment of ESBL producing bacteria, these bacteria can usually be treated with carbapenem or other classes of antibiotic. And another group, vancomycin resistant Enterobacteriaceae are enterococci. Enterococci are normal inhabited in the intestine, but they can cause urinary tract infection, sepsis and endocarditis. About 30% of all healthcare associated enterococcal infection are caused by vancomycin resistant enterococci. VRE are often multi-drug resistant. Risk factor of having vancomycin resistant enterococci are immunocompromised state, permanent medical device such as catheter or previous history of vancomycin use or had long-term treatment with other antibiotic. And treatment of vancomycin associated enterococci, uncomplicated case we can treat with amoxicillin, fosfomycin, nitrofurantoin, linezolid, doxycycline. And complicated case we can use aminoglycoside, daptomycin and linezolid. Multi-drug resistant Pseudomonas aeruginosa. Pseudomonas infection usually occur in people with hospital or immunocompromised state. Some types of multi-drug resistant Pseudomonas are resistant to nearly all antibiotics, including carbapenem. And Pseudomonas infection are becoming increasingly difficult to treat. Consideration of antibiotic selection. That should be a most effective one, safest one, cheapest and active agent with narrowest spectrum activity. Suspected UTI, cloudy urine or smell urine, whether we will prescribe or urine culture or not. Urine change may have many reasons, especially foul smell urine may cause by dehydration and other reason. And about 30% case that will be overdiagnosis. And culture should be ordered only if new urinary symptom is present. This flow sheet speaks the same scenario. If patient have a fever with new urinary symptom or urinary catheter, and then we have to order the urine culture. Preventing UTI, cranberry supplement may have some benefit in recurrent UTI, although larger scale trial are recommended. Estrogen cream have been shown to be beneficial in recurrent UTI. If urinary catheter cannot be avoided, adhere strictly to infection control or practice. Encourage full bladder emptying using double void micturition. So, our proposal, we have to use antibiotic when absolutely warranted and prescribe only registered health physician, and development and use of effective antibiotic test program like PCR or other newer technique, increase surveillance of antibiotic resistant infection. And we should reinforce the policies, programs and implementation of infection prevention and control strategy, and invest more resource in research and development of new antibiotic and vaccine, create more awareness regarding antimicrobial resistance. Mr. Chairperson and Latin audience, in conclusion, increased resistant organisms are on the rise and antibiotic pipeline is diminishing. What to do? We urgently need to change the way it prescribe and use antibiotics, and need to change the behavior such as hand washing and good hygiene. Thank you very much for patient sharing.
Thank you, Dr. Arshadul Azim sir, for your nice elaborating and awareness promoting lectures.